Hi, I'm Dr. Rajat Chauhan. I'm a sports medicine and a conservative pain management doctor. Today I'll be talking about depression amongst kids and what new research is suggesting. So Harvard Health Publishing from Harvard Medical School, the website of theirs, made a very interesting comment recently. They said 13% students from the age group of 12 to 17 years of age actually have clinical depression. They have symptoms of depression. The issue is that us adults, we think of depression in a certain way and we don't understand how it can actually present in children sometimes. Okay, so it's not the way we assume it to be. So the general impression is that the child will be sad, will have his head in his hands somewhere sitting on a staircase or on a bed or something, doesn't want to get out of the couch or the bed, not able to sleep, not talking, eating very little or maybe too much, and doesn't do daily activities. So this is the general old impression that we have of depression. Now, yes, some children can have that. Adults also, some can have that. Thing is, times have changed. Depression is still a big issue, probably bigger than ever before, and we have to tackle it. We need to know how does it present. The other part about treatment, the old assumption was, or the old school thought was that, amongst lay people, you give a couple of slaps and depression will run away. Okay? Now, the thing is, depression is real. It can mess up people. It can mess up anyone, even the best of us. And, the so-called most sorted ones as well are role models. So yes, it's very real. Impact can be as bad as, people committing suicide and stuff. And the good thing is, it's very treatable. All right? Now, in children, how it presents, besides, as I said, the classical way, it could also be dropping grades. So someone who was very, scoring very well earlier and suddenly there's a dip in the performance in school, in academically. So that can be a sign, symptom of, whatever is happening with this whole depression thing. Irritability and anger, which wasn't the case earlier, and suddenly they're very irritable, they're very angry for small things, could be because of that. Boredom, things that were very interesting to them are not as exciting anymore. Dropping out of activities like a dance class, debate team, and don't want to do it anymore. Not excited about them anymore. Difficulty with relationships, with parents, with friends. Dangerous behavior, wanting to jump out of wherever, kind of a thing. Aches and pains, fatigue, the whole body hurting. Now these could be symptoms that are there and we're missing out totally. Please remember, it could be something to do with depression. Now, a friend or a colleague, I would say, of mine who's a psychologist had told me once that amongst university students today in India, the very top ones, it could be as high as 50%. So that's crazy high of clinical symptoms that are there in students. Okay. There's another thing about depression. Most of us think, you're going to hit the rock bottom, the ones who are suffering. I mean, I've had my share of it, and we assume that we'll bounce back because we've been advising everyone else. So you could be carrying on with your regular professional life. You could be putting, I put races together in Ladakh, for now is the 9th year. Could be doing that, could be seeing patients on a regular basis, but I could be suffering with all of that and not sharing with anyone, but behaving in a very so-called regular way, right? And you're waiting for that, the rock hitting the rock bottom, and you're waiting for that rock to be there and bouncing back. I think one trick is not to fight it, not to wait for that rock. It could very well be, it's okay to be just floating. So it's something that you need to keep working on all the time. All right. And another study was talking about what is the role of exercises in depression. So normally what happens with exercise is doctors are assumed as gatekeepers, as experts at everything health. So whether it be exercise, whether it be fitness, we're just assumed to be experts at it. The fact is, in our textbook of medicine during MBBS, there wasn't a page on exercise. Okay, as much as the first line about every chronic disease would be, first line of defense is, lifestyle changes and exercise. We were never taught what exercise was all about. All right. So assumption is doctor colleagues are experts and they would know best what to do. Almost always in the society then they're telling us go walk, go run, go cycle. The point is sometimes you can't do that, right? In any case, more important than cardiovascular exercises is actually strength training. Okay, same case with depression and whatever else, the benefits of exercise and depression. There's a journal called Journal of American Medical Association. It is a peer-reviewed medical journal published by American Medical Association. And again, they have another branch under that called Journal of the American Medical Association Psychiatry. In June edition 2018, so basically now, they published a study talking about exercise and depression and how it changes it. Now, so far, physical benefits of resistance exercise training have been established, right? But not so much in mental health outcomes. So, how does that change? If you're doing strength training, if you're doing resistance training, how does that change the symptoms of something like depression? Not surprising, most research in depression is focused more on aerobic exercises. Okay, so this was more about strength training and resistance. Data from 33 clinical trials were analyzed. 947 adults were doing resistance training and 930 adults were inactive. Okay, so almost 1,000 were in each group who were doing resistance training and who were not doing anything. Okay, resistance exercises training significantly reduced depressive symptoms amongst adults. Okay, they changed the symptoms of depression across the board, regardless of health status. So whatever the health status be, there was an improvement. So what is the message there? You have to move, no matter how you feel. Get starting. Okay, it is important you get started, you get moving. It's strength training already. You could be doing slightest of things, and that's where our program that we have, the NukeLeeUs program, comes in handy. Start doing something. Strength training does not mean going to the gym only. All right, body weight exercises already make enough sense. Then the other thing was total prescribed volume of resistance exercises was not making difference of how much the results were. It's about, yet again, just get started. Don't wait for, are you doing enough or are you doing the right way? Otherwise, you'll never start because you're never doing enough or not doing the right way. Just get started. Okay, and it was regardless. Again, the benefits were regardless of significant improvement in strength. Okay, so it is okay. You just get started. The improvement in symptoms, in the depression symptoms, will be there, even if strength-wise it might not be as much as you thought it would be. The point is, just get started. In any case, efficient muscles will help you to get moving, to function optimally, getting you out there. Again, when you're focusing on, say, strength training like a push-up or squats or something, the point is, because you're so focused on that particular activity, the results are better, right? Now, all this that I've said today is relevant, of course, for patients who are suffering with this, for their families, for their carers. And come on, psychologists and psychiatrists, you need to know this and put it to practice, and you will see changes with that. Okay, so again, repeating myself, depression in children especially does not present the way we assume it would. It does not get treated by a couple of slaps. Okay, and resistance exercises make a big difference in the symptoms, the depression symptoms that are there. Okay, thing is, get moving. Okay, and follow our program called NukeLeeUs, the exercises that are there on it. Share NukeLeeUs with family, friends and foes by liking, sharing and commenting.